Good evening, my YouTube family. How's everybody doing on this wonderfully blessed Sunday? Hopefully everybody is doing great, staying safe, chilling with their loved ones, having a great day wherever you guys are in this beautiful world. This is Crypto and Stock Talk with Jaime G. That be this Mexican, not that Mexicant. That brings you the latest and greatest in the crypto and in the stock world, guys. So hopefully your account, my account, whoever else's looking's account can go up in that dollars, in that dinero, right? We're trying to make it to that $1 million mark, guys, sooner than later. None of this is financial advice, guys. This is just me, Jaime G, yip yapping on YouTube, sharing my thoughts and opinions. Nothing more, nothing less. So if you're looking for a financial advisor, I suggest you go find one because I am definitely not him. Guys, we're going to just dive right into it. I don't want to take up too much of your time today on this beautiful Sunday. We're going to be talking none other than Vaxart, ticker VXRT. Give me a second. Let me grab my notes here. All right. So now why am I putting Vaxart on our radar? What makes me bullish? Glad you asked. Well, guys, the reason why I like Vaxart, for one, and this is like one of the biggest main reasons, is because they're working on a COVID vaccine via oral pill, right? So you don't have to do it in an injection. So they're in phase 1. They're giving the results actually tomorrow. So that can send Vaxart shooting to the moon tomorrow, guys, if they give good results of their phase 1 study findings, right? I don't know what time tomorrow. So, but nonetheless, they are reporting their findings tomorrow on their oral COVID-19 vaccine trials. That's why I'm super bullish. Why, guys? Because did you guys know 19 million American adults would take the COVID vaccine if it was via a pill as opposed to an injection? Why? People have phobia of needles, right, guys? So if somebody, which is Vaxart is that somebody, can come with a oral vaccine, which is what they're working on, that's why I'm bullish. That's why Wall Street is bullish, right? And I'm going to be giving you guys some price targets from Wall Street and some levels of resistance and some levels of support for you to look out for if you decide you want to pick up some shares. I personally own 50 shares as of now. I want to pick up more, but for right now I own 50 shares. If all of that sounds good to you guys, do me a favor, destroy that like button, maybe leave a comment down below, and consider to hit that subscription bell if you're not already a subscriber. Come on, man, and join the channel. Hit that subscription bell and turn it on all so you can be notified at all times when I come through with videos, when I come through with the latest and greatest. Okay, guys, so let's read about who they are. Let's get into that real quick. Vaxart Inc. operates as a clinical stage biotechnology company which engages in the development of oral recombinant vaccines. Keyword oral, baby. It produces include influenza, norovirus, and respiratory cytomegalovirus viruses. The company was founded in 2004 and is headquartered in San Francisco, California. Like I said, guys, 19 million, guys. So what they're doing is groundbreaking, right, guys? There might be other companies doing it, but these guys are already in phase 1, guys. Hopefully on their way to phase 2 if they give good results sometime tomorrow. Like I said, did you guys know 19 million Americans would take the vaccine? You know what I mean? Now, this video is not about the vaccine. I think the vaccine is great. You know what I mean? But if 19 million more people were to take the vaccine via pill, that just means we're that much closer, guys, to somewhat getting our life, some normality back in our life. Don't you want normality back? I know I do, man. I feel like I got cheated and robbed, man, for year plus of my life. So do my kids. You know what I mean? They want to go to school and hang out with friends and all that, right, guys? But it's not safe yet still, man, for all of that. In my opinion, for my kids. You know what I mean? What everybody else, you know, to each his own. But for me, I don't feel safe when my kids going to play with a bunch of kids and so on and so forth when we got all these new variants popping up and so on and so forth. So we could get 19 more million Americans to take it through a pill. Man, I'm all for it. You know, needle injections present a barrier to get people vaccinated. And Vaxart offers a solution, guys. And that would be effective and would allow people to avoid injections they don't want to get. You know what I'm saying? That's why some people would take it, but they just don't want to take it because of needles. A phase 1 study showed Vaxart's oral tablet COVID-19 vaccine induced a T-cell response in patients, which the company believes could protect against new coronavirus strains. And the vaccine was also found to be well tolerated among its trial participants. You know what I mean? It was well tolerated. Now, Vaxart stock price gained, guys, 17% on the last trading day, right? Which was Friday. They were up 17%, right? Rising from $9.21 to $10.78, where they closed the day out. Then after hours, they went up another 8.9%, finishing the day out at $11.74. What the shares are currently going for right now is $11.74 per share. In the last 6 days, they have gained, guys, in the last 6 days in a row. So it is highly possible that it could pull back for a day or two, right, guys? They've been on a tear for 6 days in a row. That's pretty impressive. You know what I mean? And they also have this, tomorrow they're going to give their phase 1 results. So that's a 50-50, man. You know what I mean? It could be buy the rumor, sell the news, or it could be, you know, they give excellent findings and it shoots the price to the moon, right? For tomorrow, I don't know. So that's what putting this one on your radar, guys. Keep an eye on it. You know what I mean? In the last 2 weeks, it's up 101%. In the last month, 88.2%. And in the last year, a whopping 311.9%. Right? They have a market cap of $1.27 billion, guys. So they're definitely not a penny stock. They're more like a small stock company, you know, biopharmaceutical company. Right? They're definitely not a penny stock. You know what I mean? So, but they're on the next step up, which is always a good thing. Wall Street is bullish on Vaxart, giving it a strong buy rate and a price target of $17 on the low and $35.44 on the high, which that's easily like a 3x from the price it's at now, from 11 to 35. Me personally, I think it'll get there, being that they have positive results with their oral vaccine. I think it'll go past $35, right? Because that'll be groundbreaking, man. Groundbreaking. First level resistance, guys, $11.23. Second level resistance is at $11.67. And the third level of resistance is at $12.42. The pivot point, guys, is at $10.47. That is for those day traders out there. If you guys don't know what pivot point means, do your own research. Look it up. Look up the definition and see what it is. First level of support, $10.03. Second level of support, $9.28. And that third level, if it continues to go down, is at $8.82. So, guys, right now we're currently sitting a couple cents above that second level resistance, which is at $11.67. Like I said, depending on what the results are of this phase 1, it can continue to shoot up and then, you know, maybe go past that third level support at $12.42, right, guys? Which is, you know what I mean, from where it's sitting at now, $11.74. That's merely what? That's like 50 cents, whatever, however, like 60 cents, or we need to go about another 60 cents to hit that next level of resistance, guys, where we might have a little bit of a struggle. But if we have great news, I think it'll go past that third level of resistance and continue to shoot to the moon, but we'll see. And if it dips, though, just remember, first level support is at $10.03, guys. Vaxart revenue is expected to grow 62% per year. In return versus market, Vaxart has exceeded the U.S. market, which returned 55.4%, guys, as opposed to Vaxart's 311% per year. They also have sufficient cash runway for the more than 3 years. They are also debt-free, which is a great thing, guys, right? In ownership breakdown, right, guys, you have retail investors. They own 63.2%, which is investors such as you and I. We are considered retail investors. Actually, a lot of the freaking boneheads on Wall Street call us dumb money, right, guys? Because they think we're dumb and we don't know what we're doing. But I beg to differ. Hell yeah, we know what we're doing. Shoot. Anyways, that's a whole other topic. Institutional investors own 36.2%, and individual insiders such as employees and owners, CEOs, and chairmen, so on and so forth, they own 0.6%. So, which one of the big dogs on Wall Street own Vaxart? I'm glad you asked. You have none other than one of the biggest freaking institutional investors in the world, Vanguard. They own $55.8 million worth of shares. BlackRock, which is another one of the biggest, they're actually the biggest institutional investor in the world. Vanguard is number 2. But BlackRock owns $53.2 million worth of shares. You have Charles Schwab. They own $13.2 million worth of shares. You have Credit Suisse owns $2.8 million worth of shares. And Bank New York of Mellon owns $3.2 million worth of shares, guys. Guys, I always say, institutional investors are not going to invest their clients' money and their monies into stock that they don't see profits in the near and foreseeable future. They're just not going to put money, man, in a company that they don't think is going to make money. Bottom line, because that's what this whole investing game is all about, is making money, 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 and hopefully sooner than later. Right, guys? So that's why they're heavily invested in Vaxart, right? And plus what they're doing is groundbreaking, man. They're making a freaking oral vaccine pill. You know what I mean? There's nothing out there. You don't need the freaking ice. You don't need the needles. You know what I mean? It doesn't need to be stored in a X amount of temperature, right? This and that, which can make it difficult for countries that don't have the resources like we do. You know, granted, here in America, thank God we're blessed here in America, right? Some of these poorer countries, guys, they don't have freezers to store the Pfizer, Moderna vaccines, right? That it's needed to be in, you know, minus 50,000 degrees or whatever the degrees it needs to be, right? It needs to be in a certain temperature, right, guys? Or you don't need a bunch of freaking syringes for the vaccine, right? You just, boom, you have a bunch of pills put up in a cabinet, locked up, or whatever. You get the point I'm making. It is groundbreaking if they come through with this vaccine, guys, for the COVID via pill. I'm going to finish out with an article, guys. If that sounds good, destroy that like button. All right, show me some love, guys. I'm going to finish out reading this, reading this article here that I just lost. Bear with me, guys. I'm going to have to type it back up because I just lost it. Alrighty, let's see here. Let's keep going. It was in Yahoo Finance here. Sorry, guys, I had it pulled up, but it's been difficult on me here. Let me read this article I wanted to read to you right here. Right, guys, I wanted to read this to you here, right? It says, Vaxart to host a key opinion leader webinar on the importance of T-cell response for COVID-19 vaccine. I think this is very important, guys. That's why I want to read it. Vaxart to provide new data from its phase 1 COVID-19 trial. Stanford University T-cell expert to discuss cross-protection against variants, which is very, very important, guys. That's why I am saying, and this article is from 2 days ago, right, guys? So this is still fresh. Says a clinical stage biotechnology company developing oral recombinant vaccines that are administered by tablet rather than by injection today announced that it will host a webinar on the importance of T-cell response for COVID-19 vaccines on Monday, May 3rd, which is tomorrow, 2021. Oh, so 12 p.m. Eastern time. So wherever you're at, it's going to be at 12 p.m., guys. So expect the price to either go up or down at an hour before close. Okay? The progress in the United States has made against COVID-19 is imperiled by the rise of new and highly contagious virus strains. Vaxart and the new scientific community are working to respond, and T-cells are emerging as one potential answer to the new strain challenge. Vaxart will welcome T-cell expert Mark Davis, PhD, Stanford University School of Medicine, to report on the importance of T-cell immunity in COVID-19 vaccines. Dr. Davis will also discuss cross-protection against the new COVID-19 variants and future proofing against new and emerging coronaviruses. Early reports of vaccine efficacy focused on antibody production, but the ability to engage T-cells may be an important factor in determining which vaccines are most effective. Vaxart's management will provide new data comparing the T-cell response generated from its FXA-CoV-2-1 vaccine with those other vaccines. The company will also present new muscular antibody data and review their recent phase 1 clinical results that suggest the VXA-CoV-2-1 is potentially protective against new and emerging COVID-19 strains, which is very important, guys, because we have all these stronger variants, right, that are trying to take over, like poor India, man. They have these crazy double mutant, triple mutant strains and so on and so forth, man. It's heartbreaking what's going on in India, man. It's sad, you know, it's completely sad, man, what's really going on. They, for whatever reasons, this second wave is just hitting them like a freaking brick wall. It's not even like a wave, it's just like a brick wall, man. I've been just keeping up on it. It's just sad, man. The crematories are just overbooked. I seen they had like 30 bodies in one ambulance, poor dead bodies. I seen that there was a dead body tied on top of a gentleman's car. It was his dead dad's body, and he was trying to take it to a crematory. It's just sad, long story short, man. So it's super important, man, that we get some stronger vaccines that against these new variants. That's why, guys, what these guys coming out with the oral pill, God willing, it does great. It can get 19 million more people, or at least close to 19 million people vaccinated, getting us that much closer to that herd immunity that we need for this to just be an endemic. instead of a pandemic still, guys. You know what I mean? I want my life back, man. How about you guys, man? I feel like a prisoner, man. You know what I mean? With this pandemic going on to a certain degree. Anyways, let me see here. I think that's where it says to register for the web. Oh, yes, it says Mark Davis, PhD, is the director of the Stanford Institute of Immunology, Transplantation and Infection, ITI, a professor of microbiology and immunology, and a Howard Hughes Medical Institute investigator. He received a BA from Johns Hopkins University and a PhD from the California Institute of Technology. He later was a postdoctoral fellow and staff fellow at the Laboratories of Immunology and NIH, and became a faculty member in the Department of Microbiology and Immunology at Stanford University School of Medicine, where he remains today. Dr. Davis is well known for identifying many of the T-cell receptor genes, which are responsible for the ability of these cells to recognize and diversify respiratory or antigens. Other works in his laboratory pioneered studies of the biochemistry, genetics, and cell biology of these molecules and T lymphocytes. I'm murdering all these words. I apologize, guys. Generally, which play a key role in orchestrating immune response. His current research focuses on obtaining a system-level understanding of the human immune system. Man, to me, all that means is he's got a good resume. You know what I mean? From all these schools and so on and so forth. This guy is obviously important and knows his stuff. All right, so when he speaks, people probably listen because he's somebody of importance when it comes to immunology. This has involved the study of the steady state and vaccine response of old and young subjects, as well as recent study of twins, which conclude that variation in most immune systems parameters is not driven by inherited variations, but rather by environmental factors. All right, guys, so that is what I wanted to read to you guys, right? Just on, the importance of the T-cell and stuff that they're going to be sharing tomorrow, guys. If you found this video useful, guys, do me a favor, destroy that like button, man. It costs you nothing. And hit that subscription bell if you want to be notified when I come through with the latest and greatest. Guys, I think Vaxart is going to do great, aside from, even if they don't give promising results for their phase 1 trials, it's okay. It's trial and error. I still think what they're doing is great, because we do need an oral vaccine for those people that do want a vaccine but are scared of needles. So that's all I have for you guys tonight, guys. You guys stay safe, stay blessed. One love to you guys. Until tomorrow when I come through with another video, hope you guys stay tuned and stay blessed, and we hope we have a green day in the markets, right, guys? Stay blessed. Good night.